So now, next lecture by Dr. Emilia on evidence map on ozone therapy.
Yes? Okay. Hello. 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 So let's talk a little bit about the effectiveness of ozone therapy from the scientific point of view. Have you heard about evidence gap map of ozone therapy? Do you know this? Evidence gap map? No? Yeah, I'll show you. So we are here. And so one part of this puzzle of ozone therapy is always scientific evidence. The common doctors, they say it's not science, right? So let's show that's good science. So first of all, we must remember a little bit about ozone therapy history. So everything started, ozone issues, with Werner von Siemens, right, 1957. And then in the 1890, already in Germany, already was known that ozone could kill bacteria and so on. Remember that we didn't have antibiotics at that time. So in Nikola Tesla had a company, and he sold ozone oil at Sears, right? And in 1906, FDA said that ozone therapy was grandfathered into acceptance, so everything was okay. And then the First War came, and ozone was really used for treating ulcers and topical treatments, frozen feet, gangrene, decubitus ulcers, all of this, 1915. So in 1916 and 17, we had many papers published regarding ozone therapy at Lancet. So this is very important, because if somebody say that ozone therapy has nothing of scientific evidence, that's not true. It's very old-fashioned, more than 100 years, right? This is from the history. We can find that there was a book. I never found this book. I tried to find it at the internet. So maybe somebody in the United States could try to find this. But officially, this is part of the history. 40 authors, medical chiefs of major hospitals in USA, listed 114 diseases that could be treated by ozone. So, and remember that the first antibiotic only came in 1928 with Alexander Fleming in London. And then, in 1933, Dr. Morris Fishbein, the president of the American Medical Association, decided to eliminate all medical treatments that compete with synthetic drugs. So a kind of censorship, right? And then the same guy, this is a bad guy, you know? We are seeing almost the same nowadays with ivermectin and so on. Morris Fishbein was editor from JAMA during 26 years. So he decided what science was. And I've read some stories at the internet, and many people say he was wonderful and so on, and others say that he sold for a lot of money the articles at JAMA at that time, you know? So always corruption. And then, of course, FDA, from the beginning of 1940, began to disapprove medical ozone generator equipment in accordance with the guidelines of the American Medical Association. Is it good or not? So, despite this North American scientific blockade, ozone therapy continued to develop all over the world, mainly in countries who didn't speak English. So, the Russians, the Italians, and which more? Cuba, from influence of Russia. So if you look at PubMed, you can see many articles, many keywords related to ozone, right? And but it's just some words. So we must organize and try to see how is it possible to know about scientific references. So this was 219. I asked for this research, and you can see the papers going up regarding numbers of publications. In 2022, November last year, you can see a little bit less during pandemics, and now we are here. So all the time we talk about ozone, we should consider this: efficacy, scientific evidence, cost benefit, and safety. So we can see some attempts to organize the information about scientific evidence of ozone. This was a multi-center study, United States, Canada, and Italy, and they organized this meta-analysis about effectiveness and safety of ozone treatments for herniated lumbar discs. And they concluded that this ozone therapy is effective and extremely safe procedures that works in people varying from 13 to up 94 years old. And then you can see most of the studies are really good. And then another attempt of organizing this knowledge was made by Renat Fiban from Germany, and Olga Leon from Cuba, and Ziad Fahmy from Switzerland. So they had this and organized the information about major autohemotherapy and rectal insufflation. So you see, this is the general classification. If you have the level 1A, it's the best one, and 1B and 2A. 1B and 2A, it's the next step of good quality results. So we can try to find this, and they organize this information, also Renate and the colleagues. And this, another one is, what? And then other kinds of organizations of attempts to organize this, but you see, nobody accepts this. Even though we do like that, they're regular, and I will show you. So these are some references for many, many diseases, and always criticizing that the study was not enough, and so on. So there's another systematic review done in Brazil at the University of São Paulo, and they had a very good and said that paravertebral injection is level 2-1, and intradisc injection is 2-3, another classification also that could be. We did this Cochrane review in Brazil, the Cochrane of Brazil, so for lumbar pain, and the result was really good. It's written in Portuguese because the guy that was in charge of doing this and we raised money for paying for this job. Not so, not so low, a lot of money for having this. And at the end, he refused to publish because it was good. You know? It's unbelievable. I almost, I was really mad with him, but because it's an absurd, right? But so the general sense makes you to follow this pyramid, right? So systematic reviews are on the top, and then other guidelines, and then you go randomized controlled trials, cohort studies, case control, and case reports. So the less valuable is the expert opinions, so the case reports. So one thing that's very interesting that in my point of view is this. This is the classification of the two biggest societies, American societies of cardiology. So they did this, and they concluded that only 11% of the procedures made in modern cardiology are level A, the maximum, 11%. It means that, you see, 89% are not level A. And in fact, 48% are level C. That means that are related to experience of the doctors. So it's not valuable officially. So when a normal doctor say that this ozone therapy has no scientific evidence, and said cardiology either, you know, only 11%. That's it. So you see this model of pyramid is starting mixing, and they are trying to make a new model. So it's going from this triangle to the round model. And you see, that's interesting because it's published. And just showing that this evidence should be a mixture of clinician expertise, patients' clinical state and circumstances, patients' preferences and actions, and relevant research evidence, not only pure scientific evidence regarding the pyramid model, you know? So a new way of looking at this question of scientific evidence are the evidence and gap maps. So this is an emerging method of rapid review that involves a systematic search and characterization of existing research on a topic of interest. So it identifies gaps in knowledge and needs for future research. So this evidence mapping can also help identify rich study areas for which systematic reviews and meta-analysis can be conducted. So we founded the Brazilian Society of Medical Ozone Therapy in 2019. We decided to have some groups of study and started doing these gap maps of scientific evidence. And at that time, we had 3,069 articles, scientific articles. So this was the team. The lady on the left side is Ramachandra. She is a Brazilian Indian, my friend that now lives in the United States, also a medical doctor. And the other one is Caroline and Veronica Abdallah. And Veronica Abdallah is the chief of the BIREMI, the library, virtual library from Latin American, very important library. And she is the one that is leading this movement of changing the way of viewing scientific references. So the Brazilian Society of Medical Ozone Therapy, which with the institutional support of the World Federation of Ozone Therapy and BIREMI, BIREME is connected to Pan American Association, yeah, and also with WHO, the World Health Association. Built 2 maps of evidence of medical ozone therapy, which through innovative methodology developed by BIREME, compile all the most important publication clinical trials related to the effects of ozone therapy on human health. So we built this list of keywords. So this was our first meeting, and we decided what to look for. So we look at these platforms in order to search: PubMed, Embase, and BVS, VV Salud. So this was a tough tough job, because we had to throw away everything that was not ozone on health. So it means ozone in nature, ozone pollution, all the other ones, because usually this is the main issue that the oppositors, they used to say that ozone is toxic. So we know we use ozone inside a therapeutic window, right? So ozone in the nature, ozone pollution, atmospheric pollution, it's not ozone therapy. So we had to quit all of this. And then it came the first map, the general map. So we did all this PRISMA and selections of the studies and so on. We started with 559, I think. And then we remained only with 26 studies. So we read all the papers, right? And then we decided to classify the interventions regarding the type of injections or the use, the procedures. So the routes of administrations that were written down on the papers. So this was the classification, routes of administration. And here you can see the countries and the years of publications. So it's not nothing for Africa, and Mexico, Brazil, and Spain, Portugal, and that's it. So here you see that's the number of the patient, the country of origin of the systematic reviews were taken into account. So most of them, you see, we had the numbers of patients that we analyzed. And also we applied the ZAMSTAR, that's a classification for evidence level of the article itself. So we must join a lot of conditions and classify, give a number in order to say it's a good study, it's a moderate, or it's a bad study, and so on. So the ZAMSTAR, and here is the resume of all of the studies. You have this PDF later on, so you can read, right? And then all 26. So let's go to conclusion of this part. So the main discoveries. So these studies, first we did this in 2019, and we repeated last year to up to date, because we sent to publication. And this was the conclusion of the map. So analyzing all these 26 systematic reviews, we evaluated the routes of administrations, parenteral oxygen, ozone gas mixture, gas, ozonated water, systemic routes, ozonated water for topical application, and topical gas mixture, and also topical ozonized oil. There was more evidence on the parenteral application of oxygen ozone gas, followed by local and topical application. So interventions that were associated with 55 health outcomes, divided into 7 groups, mainly. All these 26 systematic reviews. Cancer, this means the applications of ozone. Cancer, infection, inflammation, pain, quality of life, wound healing, and adverse effects. In total, there were 334 associations between intervention and outcome, with emphasis on the interventions of parenteral gas, right? So it's major autohemotherapy. 57% of the publications were related to this. With reference to the effects reported in the studies for the intervention outcome associations, for most associations, a positive or potentially positive effect was reported. Inconclusive was reported for 132 associations and no effects for only for 8 associations. The main outcome was evidenced in the pain group, followed by the quality of life and wound healing. Among the outcomes, pain reduction, low back pain, and improvement of physical function stand out. The benefits of ozone therapy have been shown to reduce pain, reduce inflammation and infection. Most of the primary studies included systematic reviews, are concentrated in countries in Europe and Asia. All the other studies are from the United States, Brazil, and Cuba. 5 systematic reviews did not report the countries where of the primary studies. So the main discoveries of the general gap map of ozone therapy is that the effects were observed in systematic reviews. 14 positive, 5 potentially positive, 5 inconclusive, and 2 without effects. Most, because it was updated. The first one is the one that we did in 2019. But it's the same because this is the one that's published, and I already sent Millie, Dr. Millie, our paper. Most of the available evidence focus on applied ozone therapy for pain reduction. Other evidence evaluates the effects of ozone therapy on healing, reducing inflammation, and reducing infection. As for type of intervention, means the route of administration, there is evidence of concentration in the parenteral application of oxygen or ozone gas mixture, followed by local and topical application. In addition to expected clinical outcomes, the map includes a group of outcomes related to possible adverse events, effects of ozone therapy. Nothing special, you know? Only basically pain in the local of application and some case of infections because the care was not done properly. Oil and ozonated water on human skin did not have significant associated dermatologic risks. So this evidence map gives prescribers confidence in the benefits of ozone therapy in reduction of pain, low back pain, improvement of physical function, healing, reduction of inflammation and infection. So this is the website of BVS. It's a BIREMI, the library, the virtual library. And this is the map. It's in Portuguese, but it's also in English. So if you access, you can read everything in English. So this is BVS, Biblioteca Virtual em Saúde. So this evidence map. So you see like that. So every time you see green, it means that is good level of evidence. If it's yellow, moderate, and red, low level. And the size of the spots means the number of articles. So you can look visually and have an idea what's going on in a specific area. So this side here, the column, means the interventions, the routes of applications, there, the outcomes. So here means the size of points of the bubble chart. According to the number of scientific studies, the points were given different size distributed in each corresponding result versus routes of administration. The larger points were related to 3 or more studies, the medium points were related to 2 studies, and the small points had only 1 study. Regarding the color, circles located at the intersections between interventions and outcomes represents the identified studies and quantity. The color of the circle represents the study design. Green for randomized clinical trials, yellow for non-randomized clinical trials and quasi-experimental clinical studies, and red for case reports and case studies and control. So this is the general map, general ozone therapy, and you see for here the routes of administration, then you can see the best result for each condition. So it's like that. So it's the general view. So it was really a tough activity, you know, because we wanted to see something and try to change the view in order to have a tool for this. So after 9 attempts, 9 magazines, scientific magazines, only the 9th, we managed to publish, and it was published in Frontiers in Public Health. That's a very good magazine. Its impact factor is 6.461, so above 4 is already a very good scientific magazine. This is 6.4, so this is our paper. And then it's really amazing because I think they do in order you give up, you know? You try 1, no. Second, no. Third, no. 4, no. 5, no. 6, no. 7, no. 8, no. 9, yes. And yes, with this impact factor. So it was amazing. And then we liked it the way it came. You see the things happening. So we decided to do to see the clinical effectiveness of medical ozone therapy in COVID-19. So it was interesting also because we did the same methodology, because it's interesting because everybody can repeat, you know? It's not, oh, I think that's this way. It's not, I think, I believe. I think, you know, no, that's not like that. So when somebody come now and say, oh, ozone therapy is not a scientific issue, sorry, my dear, you must see the map. Because it's really, so we did the same with COVID-19. At that time, we found 602 studies. At the end, at the beginning, 11 studies, systematic reviews, and last year we updated to 13. And here also we saw routes, means interventions, and the intravenous systemic with intramuscle, so major autohemotherapy, minor rectal insufflation, or saline. And then here we have all the studies, clinical trials studies, 13, and this is the conclusion, the main finds. The studies were carried out in 2020 in the following countries: Spain, China, Italy, India. You see, India was here in Iraq. These 11 clinical studies analyzed involved in a total of 259 patients with COVID-19 who received ozone therapy. All results were positive, both in patients with mild to severe severity, being mild to moderate in 2 studies, moderate to severe in 1 study, mild to severe in 1 study, moderate in 1 study, severe in 6 studies. This specific is very important because if you use ozone in a person that is mild, it's very different to use in a patient that's in intensive care unit, you know? Sometimes if something happened with the patient, depending, they will say that it was ozone that killed. So it's important to have this kind of care. The most reported type of intervention was major autohemotherapy, route of administration, in 19 outcomes, followed by rectal insufflation, presenting 17 outcomes. The most frequently reported 6 outcomes were, this is very important, overall improvements in clinical symptoms of COVID-19, 11 studies, reduced length of stay at hospital, decreased C-reactive protein, decreased ferritin. You see? Decreased ferritin, the major autohemotherapy, because ferritin is an inflammatory marker. Decreased lactate dehydrogenase, decreased D-dimer, no reports of adverse events. The concentrations of ozone therapy in the major autohemotherapy varies between 20 to 45, being 40 the most used concentration. For the rectal insufflation route, a concentration of 35 to 40 was used, of the concentration of 35 the most used. So when we updated the 2 more studies the last year, the number of patients rose to 271. The results all positive. The major autohemotherapy was the most frequent and the same. But here we can see also improvement of respiratory function, improvement of oxygen saturation, and a decreasing interleukin 6, radiological improvement of lung lesions, and absence of reported adverse events. Then the concentrations were the same. So it was the first clinical evidence map on effectiveness of ozone therapy as integrative medical therapy. So it means low cost, efficient, and useful as a complementary method of adjuvant treatment of COVID-19. For all interventions and outcomes, further research and studies with methodological quality and uniformity of assessments with the aim of achievement a greater level of confidence in the results presented here. And then we managed to publish, again, this magazine is not so well known, but it's a good one. So it was, the most interesting part of this is that we did a trial in Brazil with, in the south, in the biggest public hospital in Rio Grande do Sul, in the south of Brazil, and we saw clinically exactly the same as we found at the gap map. So the gap map really reflects what we see clinically in the other one. So here is the gap map of ozone therapy in COVID-19. So that's it. Thank you very much. Any doubts?
We'll have to move on to the next
Yes.
last speaker. If you're here, we can definitely take the line. Thank you, Dr. Emilia. I think just please accept the small gift. Thank you.